My name is Dr. Janet Settle. I'm an integrative psychiatrist. I've been in private practice in Denver, Colorado for 25 years. In 2000, I was in the first class of physicians that was board certified by the American Board of Integrative and Holistic Medicine. There weren't very many people practicing integrative psychiatry in the country at that time. I knew of maybe a handful of people in the country. So I started writing. I was invited to write several textbook chapters on nutritional supplements and mental health. That's when I was exposed for the first time to the Hardy Nutritionals Daily Essential Nutrients. Looking back, I was confronted with the really significant limitations of the standard therapy that's available for psychiatric disorders. And what I've discovered in what's turned out to be a very much longer quest than I ever thought I was setting out on is that there are a whole variety of root causes behind mental health symptoms that are really underappreciated and undertreated. And nutritional status is one of those. I start with managing the symptoms, and then I move on to just identifying and treating the root causes. One difference between my practice and the standard psychiatric model is that I combine both psychiatric medications, traditional psychiatric medications, with nutritional supplements. So I call that green pharmacy. So you have your prescription pharmacy and you have your green pharmacy, and I combine, mix and match depending on the severity of the situation and the preferences, of course, of the client. Some people have a very strong preference for pharmaceuticals. Some people have a very strong preference for, natural supplements. So I try to mix and match, and I have all of those tools at my disposal. Another difference between my practice and a standard psychiatric practice is that I use other lifestyle-based techniques like prescribing exercise, dietary changes, lots and lots of meditation of various kinds, other mind-body techniques, biofeedback, anything you can do to get the autonomic nervous system balanced, so you can take that kind of sympathetic hyperdrive out of the picture. So that's another difference. And then maybe the biggest difference is that in my practice, unlike other standard psychiatric practices, I look for root causes, underlying physiologic body-based root causes that have everything to do with inflammation, the immune system, infections, toxins, hormones, and nutrient deficiencies. The standard psychiatric curriculum and training is limited to treating symptoms, with the exception of looking at the root cause of, say, hypothyroidism, and maybe some other really rare, obscure things. But, we are trained to look for hypothyroidism, but we're not trained to look for any other root causes. I attended the conference that was taught by Dr. Bonnie Kaplan, who's a leading worldwide researcher and expert on the use of micronutrients in mental health, and had several colleagues who were using these supplements heavily in their practices with glowing results. So that was my first exposure to Hardy Daily Essential Nutrients. I routinely use Daily Essential Nutrients for anybody who has trouble with irritability, with temper, with distractibility, racing thoughts, mood swings. Typically, these are symptoms that you see associated with some kind of bipolar disorder. They might also be symptoms associated with attention deficit hyperactivity disorder. But that's the place where I get the most bang for the buck, and I will reach for those without hesitation in almost everyone I see who comes in with that kind of symptom pattern. My protocol is to have people start with 2 tabs a day and increase each day by 2 tabs. So then by day 6, they're taking the full target dose of 12 tabs a day. And then I tell them to expect to see benefits within about 1 to 3 weeks of starting those 12 tabs a day. I ask people to give it a full 30 to 60 day trial, to fully assess the benefits, because the biochemical changes that you're making in the body take some time to sink in and take effect, and there can be substantial gradual improvements over time. But I generally find that people see benefits within the end of about the first week. I do have patients who take both standard pharmaceuticals and daily essential nutrients. One of the things I really like about the product is that I have the freedom to use both. And I don't feel like I have to rush people off of their medications unless there's some medical reason that they need to be in a hurry. I do taper people off of standard pharmaceuticals if that's their goal and if I think that the pharmaceuticals are causing a problem for them. But I like not to have to rush. I'm not one of the integrative medicine people who's on a big crusade to eliminate all psychiatric medications, because I know too well from the inside, after 25 years of doing this, that there's a real important place and role for psychiatric medications in all of these treatments. That being said, there's unfortunately a stigma, and people all day long are saying to me, how can I get off these meds? How can I get off these meds? How can I get off these meds? And so people are uncomfortable with the idea of needing meds. People are uncomfortable with the idea of dependency. People are uncomfortable with side effects, which are often real and sometimes perceived. And so it's nice to have something that I can offer to people that they're happy with, that they think, oh, this is making my health better. And so I'm going to continue this for as long as I can. I recommend daily essential nutrients because I know that I'm going to help people with their mood swings, especially with their irritability and temper, frequently with their distractibility and impulsivity. It's just a great tool to be able to offer people for help with all those problems. The Daily Essential Nutrients is a broad spectrum product that includes over 40 micronutrients that are essential to running the brain and running the body. I recommend it because if I have someone taking the Daily Essential Nutrients, then I know that from a supply side, everything that's needed by the body and the brain is being offered. Then I can get into thinking about, well, are they absorbing it? And then once it's in there, is it enough, or is it the right thing, or whatever? I mean, I can just stop worrying about the supply side and then turn my attention to other root causes. One of the problems with medical research is we want everything to be a single silver bullet. We want it to be like, oh, it's magnesium, or oh, it's zinc, or oh, it's, vitamin E or something like that. So all these studies happen where there's just a single element, and there's a lot of funding that goes into that kind of research. But the reality is that we've got thousands of biochemical reactions happening inside of our brains and inside of our bodies in every moment, whether you're blinking or you're thinking. Your body needs biochemistry to make all that happen. And every one of those biochemical reactions is dependent on one or more minerals or one or more vitamins. So if you're just going to say, well, let's, take these rats and take all the magnesium out of their diet and see how they do, you're really not going to understand the whole spectrum of things that go into making an organism or a human healthy. This approach, where you really are giving such a robust dose of all the micronutrients that are needed for the biochemical reactions that run the brain and the body, this approach really covers all the bases, in my opinion.